S.M.Suresh, consultant diabetologist from Suresh Care, Rajajina, Bangalore. I am from India. I am studying PG Diploma in Endocrinology from University of the Southwest. My batch number is 08-2013. Today I am going to speak on efficacy of the thyroid nodule. Before going into the efficacy of the thyroid nodule, let us discuss a few words on the anatomy of the thyroid gland. Thyroid gland, as we know, is one of the largest endocrine organ in our body, which is bi-lobed structure connected by the isthmus, which is situated in the neck on either side of the thyroid cartilage below the iliac bone. As we know, this thyroid gland produces the hormone T3 and T4, which regulates the growth and rate of functioning of the many systems in our body. But these hormones are again controlled or regulated by the TSH and TRH from the hypothalamus and pituitary gland from the center. Then we will talk about what is FNAC. FNAC is fine needle aspiration cytology of the thyroid for the diagnosis of the thyroid disorder. For the results of the FNAC, they are classified as benign, malignant, suspicious and inappropriate for the diagnosis. As we know, during the last 2 decades, FNAC has emerged as one of the most reliable and cost-effective method in the diagnosis and management of the clinically important thyroid disorders. Then we will go to know what are the indications for the FNAC of the thyroid nodules. The first indication is when you have suspicion of any nodules in the thyroid gland, that means which is more than 1 centimeter, which is palpable. Or if it's an ultrasound candidate thyroid nodules less than 1 centimeter, this is the usually we do to confirm whether the thyroid nodule is malignant or benign, or if there is any rapid growth of the nodule, or is there any coarseness of the voice, or presence of the accompanying cervical lymph nodes. These are all the indications for the FNAC of the thyroid nodules. What is a prerequisite for the FNAC of the thyroid nodule? The first very important is TSH measurement, then diagnostic thyroid ultrasound scan. Any contraindication for the FNAC of the thyroid nodules? No, not much contraindication, but to minimize the risk of the post-procedure hemorrhage, the INR should be less than 1.5 and platelet count should be more than 1 lakh. Any anticipated adverse effect? Yes, there may be extravasation of the blood, pain and tenderness, or maybe local swelling in the area at the site of the FNAC. To minimize this, you have to do the manual compression of the biopsy site or use a small needle size of 25 gauge needles can be used. There are 2 types of FNAC of the thyroid nodules. One is which is done manually if the nodes are palpable. Second one is ultrasound guided FNAC of the thyroid nodules. What are the materials we are required is FNAC? We usually need a needle between 23 to 26 gauge needle with a 10 cc syringe, few slides, and with a marker to mark the patient name and lab reference number. Usually the maximum puncture done on each nodule is about 3 punches, but here local anesthesia usually not required. This is a painless procedure. The role of the FNAC in this ultrasound guided FNAC is usually if its nodule is less than 1 centimeter, or sometimes if it's very difficult in the neck examination, or growth of the nodule with previous benign FNAC, solitary or multinodular nodules. Sometimes it is associated with the cervical lymph nodes, then FNAC can be done through ultrasound guided method. How to do the procedure? First you have to clean the area of the FNAC. Then take a 25 gauge needle, do about 2 to 3 puncture on nodule. Then prepare the slides with the smear. One smear for the fixation with the alcohol, 95% alcohol, and one air dried smear. After preparing this, then identify the slide with the patient name and the lab reference number. Please send us these slides prepared smear for the pathologist or histopathological report. Once the lab reports comes, then we can identify whether this thyroid nodule is malignant or benign. Thank you.